How does a fat transfer work with breast explant surgery? So, this is a phenomenal question in terms of an evolution of fat transfers. Fat has been moved around for over 100 years. It is the first and obviously the most natural filler because it's from your tissues. And so, on many shows, I've explained like chronic inflammation and how your body has tolerance when it's your own tissue. So, along the lines of that, how does fat moving from one place to another work? And so, fundamentally, I have patients who obviously they got a breast augmentation because they either lacked the tissue from development and wanted more volume, or after having children, going through breastfeeding, felt the breast had deflated, it had not recovered, it was maybe sagging, needed to be lifted with or without volume restoration. So those are the common, quote unquote, reasons. The fat transfer has been used in cosmetics to help volumize, even if someone had rippling, help with that as well. And then in reconstruction, I used fat transfers for almost 15 years to soften the contours of an implant-based reconstruction or to augment a DIEP free flap breast reconstruction, which is what I did predominantly in my career. So let's break down the elements of a fat transfer. Well, first, you have to be able to get the fat. So, can someone have a low BMI and still have a fat transfer? So, the answer is yes. And can someone have a high BMI and get a fat transfer? Of course, the answer is yes, with a couple caveats. And so, if that's the nature of the ask and the consultation, I will listen to my client and try to vet, what can I do for them and do their exam. And then if that seems like one, they have fat that I could use, and of course, we want to use that if we can, then it's about establishing each person's ability to have a fat transfer. And I'll go into that now.